Hey everybody, it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation, and today we are catching up with tech-enabled habit change provider Newtopia, talking to their CEO and founder Jeff Ruby about just how bad things have gotten with people's everyday health as a result of the pandemic. Jeff, I'm really excited to talk to you about this because I've been looking for a state of play on our general health status for a while. Nice to have you here.
It's so fantastic to be back. I hate to be the person who's got to talk about how bad things have become, but it's really nice to be back with you guys.
No, I mean, this caught my eye because like I've been saying this all along. I'm like, for a while I was calling it the banana bread epidemic because it was like, remember early on in COVID, everybody was making banana bread and like doing all these recipes and baking stuff at home. And I'm like, this is going to have an impact down the road. And here we are now 2 years down the road, and it has had an impact. And it's not only, like physical in terms of weight or, things like people who are more like a rise in prediabetes, but also our mental health has suffered. I mean, a lot of different things. So, give me an insight on, what you've been looking at. I mean, Newtopia, I know you guys are tracking and working in this chronic condition space, and you have been for a long time trying to change behavior there. But what have you got your eye on in terms of populations of people and just how the pandemic has changed our health status?
Yeah, I'd really categorize it as two things. One stat that caught my eye a couple of weeks ago was a report in the New York Times that up to 40% of the Americans who passed away so tragically during COVID had type 2 diabetes. If you just step back and
Yeah.
think about that number, that's nearly 400,000 Americans whose lives were lost because of an entirely preventable lifestyle disease. And it's sobering and it's so frustrating. The second impact, of course, is all of the lousy habits that we have all adopted as a result of the banana bread. 1% of Americans reporting a change in habits, whether that's around sleep or whether that's around more time on a screen, whether that's around mental health, which we all feel, eating poorly, inactivity, which is the tinder for more lifestyle related metabolic disorders, whether it's obesity, type 2 diabetes, heart disease, stroke, MSK, cancer. And so you've got this like twin effect. The pandemic has killed 400,000 people with type 2 diabetes. And I think the population is worse off 2 years later with even greater risk for more diabetes-like disease. And it's kind of terrifying.
It is. It absolutely is. And it's like that 61% having a habit that they've picked up as a result of, just their behavior change over the last 2 years. I mean, I think that's really staggering to me because, I mean, it's so easy to pick this stuff up, Jeff, but it's really hard to change those behaviors. So I'd like to hear a little bit about where you guys have found yourself now because, and you may have to just back up for a second for those who might not be familiar with Newtopia and just talk a little bit about your model because it is very unique in this chronic care, diabetes, weight management, mental health care space in the sense that you guys are like, it's like pre-primary care. It's preventative. It is very much behavior change. And you guys have always been a little bit of an outlier, but I'd like for you to kind of introduce us to Newtopia again, for those who may not be familiar. And then talk about too, if you can, how you feel like you're in a unique position as a result of the pandemic and this population of people that now have habits that they need to change.
Yeah, absolutely. So, I mean, just maybe as a refresher, Newtopia is a tech-enabled habit change company, or we call ourselves habit change provider, that is really bringing the best of humans and the best of technology to affect new and sustainable and durable habits around nutrition, exercise, and mental and emotional health. And so as a provider of whole person care, we're really interested in getting to know people socially, behaviorally, and genetically. And we've pioneered this area we call genetic engagement, or using behavior genetics to help inspire individuals to make these changes, so that at the end, we can deliver both improvements to physical risk factors, improvements to mental risk factors, all proven to not only be significant reductions in the likelihood of developing chronic disease, but with proven cost savings, proven ROI, and deliver outcomes that grow. And you're right, we are a little bit unique as many digital health companies forced and moved toward condition management as their raison d'etre, managing type 2 diabetes or managing cardiovascular disease or just managing more sick care. We've always stayed true to the prevention side, really focusing on the 80% of the population that has elevated risks and seeing if we can't stem the tide by capturing them earlier for the benefit of health insurers so they don't have to manage illness, but actually can prevent it in the first place.
Yes, and that's right. And I remember you guys came out of Aetna, right? You were incubated there. Is that right?
That's absolutely right. So we were kind of discovered in the Aetna Innovation. So we're now about 2013 to 2016. Aetna Innovations found us through the help of Accenture and ran a 3-year randomized control trial. Bet the company on this large-scale trial on just shy of 3,000 Aetna members. It was really proved to be a good bet because we were able to publish peer-reviewed evidence of both the efficacy of that whole person approach, the cost savings, the ROI. And ever since, we've been able to improve upon those numbers through great innovation partnerships with groups like JP Morgan Chase, with Accenture, and have been able to master some of the behavioral economics on the top line as well.
All right, so you guys find yourself in this very unique little spot of being, prevention focused, being behavior change science based, with all the other goodies around it, the genomic part of that I love. And then and you're different from that chronic condition management crowd. Now, here we are, like we said, draw the line to us to what's happening with Newtopia as a result of the pandemic. Because I mean, it's interesting where you guys are at right now, because it's like, is it too late for some of this prevention stuff, or like where are you guys feeling like you can make the most impact, knowing what we just discussed in terms of how much more unhealthy generally Americans are these days than they were 2 years ago?
I think that the tragedy of, again, nearly 400,000 Americans with type 2 diabetes passing away is that condition management isn't going to help it. Once those, the rate that with all the efforts at managing folks with type 2 diabetes in these digital ways, and I'm a giant fan of these approaches, but in some ways it's a little bit too late. And so we think there's a huge opportunity for us to help the health insurers out there, whether it be self-insured employers or fully insured payers in the MA space or ACO space, and we can talk more about that, to manage the risk down of their populations. And the one thing that I know for sure, and they know for sure, is that 2 years later, all of those populations that they are at risk for are now riskier than when we began.
Yeah.
And so they're staring down the barrel of 2022, with cost increases estimated at anywhere between 8 to 10%. That's a shocking number after a couple years of odd numbers when people weren't going to do any care. And the prospect of even riskier populations. It's just it's a perfect formula for a disaster, and condition management's not going to solve that disaster. What's going to solve that disaster is intervening at that point of risk, hopefully at that point of fear for individuals that they're leaning toward chronic disease, and a point of terror for the health insurer who are facing down the prospect of all of these individuals who are not only sort of poised for the great resign, but are poised for worse medical conditions and a huge cost rise.
So I mean, I want to push on this point about the riskier populations who are headed in a particular direction, either to have new chronic conditions or to exacerbate the conditions that they already have. And the thing with behavior change, and I've asked you this before, and I've said this to you, and I want another opportunity here for you to address it. But the behavior change is hard. Much easier to throw some prescription drugs at this, especially if the costs are going up. We don't really have the time and the luxury. So I mean, what do you have to say to that? How do you combat that?
I think this concept of behavior change is hard is a bit of a canard. It's one of these things that we tell ourselves, just look at what's happened to all of our habits over the last 2 years. Granted, it took a global pandemic, but many of our habits changed. Habit change is possible. We went in the wrong direction. But when you put people at the center, when you really give them the benefit of the doubt that there's an opportunity to inspire them and to motivate them and use the right behavioral economics, they're the same way that habits can go the wrong way, they can go the right way. So it takes the right approach. I don't think it's hard, but I think it takes putting the individual at the center of the equation, not a curriculum and not a let's teach them or tell them what to do. Nobody wants that. We've learned that through the vaccination attempts over the last 2 years. No one wants to be told what to do or instructed, but individuals really do appreciate the benefit of learning about themselves and being inspired and having their confidence built so they become the engine of their own growth. That's at the essence of Newtopia's really deep, personalized model. It's what's made us so successful. And I think it's one of the routes to help heal from the pandemic and to lessen this risk burden that we're all facing down.
All right, I want to hear a little bit about that success. So brag for us here, because I understand, I mean, the last time I spoke with you, you had just recently put out the results of like it was an economic feasibility study, I think, or something, in terms of how much money could be saved using Newtopia's program, and it was done with a Medicare Advantage population, and I believe the number was something around 1,700 per member. And talk more about that. Like, give us a sense of like, how long does it take? How much money could be saved here? Like, brag for us about the success here of the Newtopia program.
Great. So I'm gonna give you two perspectives because I'm so proud of them. I'm gonna talk about the MA in a moment, but just so happens that we have been fortunate in an innovation partnership with one of the leading financial institutions in the world to participate in this behavioral economics trial. And it just coincided, the 24 months of the trial coincided nearly perfectly with 24 months of our COVID experience. And what we were experimenting with is applying some great economics to incent participation in health improving behavior. But what we were able to do is see just over 70% of participants at risk take us up and join the platform. That's compared to about 25% we normally experience, which was already high, but 71% of an at-risk population enrolling is almost unheard of.
That's awesome.
At the end of 12 months, 86% of those individuals were fully engaged, which dropped to 83% at the end of 24 months, which drops to about 70% at the end of 36 months. If you can show me another lifestyle change, habit change experience, driving high 80s, low 80s to 70 after 36 months, I'd like to meet them. And all the while, we're driving some of the best clinical outcomes we've ever experienced in terms of that percentage of the population, just over a third, who are both dropping significant physical clinical risk factors and significant mental and emotional risk factors. So delivering beautifully on that whole person care. This is straight through the pandemic. In the hardest time possible, we've just delivered our very best outcomes, totally countering the trend. So super proud of that, and know that that can be delivered at scale with any health insurer clientele. What you just referred to on the second side is a movement afoot to expand beyond employers and see if we can't take the Newtopia approach and have a meaningful impact across Medicare Advantage populations. And so here we started, similar to the way we proved ourselves commercially, with an actuarial study suggesting that we should be able to save about $1,700 per member per year. Now that we've got the research done, we're just days away from inking our first major MA contract with a leading regional player. We also have some of the biggest national players in discussions as well. And the hope here is that we can replicate the kind of cost savings, but really, can we start to have an impact across gaps in care, quality metrics, stars ratings, which we know we can impact to not only deliver that $1,700 in cost savings and cost avoidance, but also meaningfully generate increased revenues. And so I'm really psyched about the movement into health plans, and in addition, to be able to serve and increase the size of our employer client base.
That's awesome. Congratulations on that. Those are some big pieces of news there. I'm excited to hear that. I mean, and yeah, very cool about the success that you've been able to achieve over a long period of time in terms of engaging and keeping employees engaged in the program. That's wonderful. I have to ask you a little bit about the business, and I have two big questions here, Jeff, and they're not going to be easy ones. So the first one is about your model, because I know you guys are at risk. So you're completely at risk, 100% on fees for all of the. There's a variety of different mental health and physical health, metrics that you're meant to hit before you guys can get paid. So based on this entire conversation we've had about just how much sicker everybody is coming into this, I mean, how does this impact your business model, my friend? I mean, does this actually put you in a better position because you have more potential clients to work with, or does this put you in a worse position because these people are just that much more worse off? Talk to me.
So the easiest way to build and scale a digital health model is not to go at risk. The easiest way is to choose a capitated per member per month model where you're getting guaranteed revenues, your investors love the certainty, looks like SaaS, and away you go. Here's the problem. It's the number one way not to give a crap about driving an outcome, because why drive an outcome when you're getting paid nonetheless? Now, I probably just upset a whole lot of my colleagues out there who are pursuing that model for the purpose of their investors, but I believe that to really do this the right way, we have to be a partner. We've got to be part of the value base in the performance side. It does make it a little harder for us from a certainty perspective, but I'm so certain about our results that we are prepared to go full risk for reducing physical and emotional, driving that whole person care. And I think the state of the market today, as value-based is not just talk track, but becomes more real as it moves from CMS into commercial populations where it seems to be afoot, and there's a real movement around accountable primary care for commercial populations. Boy, I love that we have the experience doing this, being a public company, reporting publicly and growing. And so we are not moving away from full risk. And in fact, I think it's going to serve us incredibly well as we move forward.
Okay, I do have to ask, this is the other hard question. You walked right into it, my friend. The public market. I mean, you guys are publicly traded in Canada, and I mean, we've seen this happen in Canada and in the US. The last year or so with these health tech or digital health stocks has not been good. I mean, things really took off during the pandemic, and then as quickly as they heated up, they just cooled right back down. I mean, what are your thoughts on that? I mean, is this, everybody's concerned about it, especially here. We've seen a rollback in the number of companies who have even decided to go public now. I mean, what are your thoughts on this as the CEO of a publicly traded health tech company?
I believe we were the first digital health company to go public in March of 2020 as the pandemic was rolling out. And it's been turbulent and it has been fascinating. And I would say that we're certainly making efforts to expand our investor base. We love our Canadian investors. They've gotten us to this point, but I do think that there's a little uncertainty and just unawareness of how US healthcare works and where innovation drives. And so we're definitely driving more toward broadening our base with US healthcare. And so stand by for more updates as we move in that direction. But one of the things I would also say is that I think in many ways, there's been a digital health or health tech 1.0 movement afoot. And a lot of those folks went public either during the pandemic or as things were looking awfully good, where what was analog was then digitized. And so what I call sick care in analog form was digitized by some incredible platforms, incredible technology. And of course, as the analog became unavailable because of social restrictions, it forced the digital to rise, probably sped things up by about 10 years, which was fantastic. And now, of course, as things seem to be resuming back to whatever the new normal look like, there's a bet that some of the digital may pull back. I describe all that because that's not us. Newtopia is not a health tech 1.0 company. We represent what I will call health tech 2.0, in that there is no analog for what we do. There is no scaled primary prevention in some physicians' offices or health system today in the United States. And in fact, we are here because we believe it's needed. But I think in some ways we have been maybe bundled and cohorted into digital health 1.0. And I get why. We look virtual, we serve employers and health plans, and it kind of looks like we're doing similar things. But I do believe that our time and moment is coming, as there's a recognition that in fact, digital health 2.0 needs to come. We need to move past just digitizing what is analog and actually covering what is not analog, the primary prevention side. So again, come right back to the start. We can avoid the 400,000 Americans who died of type 2 diabetes from COVID-19, from it happening once the next pandemic, which we have to believe there will be, from coming. And unless there is that movement afoot to move from digital health 1.0 to digital health 2.0, we're never going to get there. And we're on the front line and the real new front door of that.
All right. Well, I'm fired up. It's your moment. I love these. This is our moment. I think this is great. Jeff, thank you so much for stopping by and for catching us up on everything that's been going on with Newtopia. And I do think, there is a lot of confusion about your model versus some of the others that are in this space. So I'm hoping that those who are out there who have heard you talk through it have a clearer understanding of the way that you guys are separate and are part of that 2.0 movement, particularly among those publicly traded companies. So thanks again.
Thank you. It's really great to be here. Thanks, Jess.
All right, you'll have to catch us up when you get to new news, Jeff. Everybody, that's Jeff Ruby. He is the founder and CEO of Newtopia, talking to us about how things are going to pan out in the next couple of years here as he tries to change behaviors for a whole bunch of people who picked up some bad ones during the pandemic. We'll have to see how that goes. For more with the who's who of health tech as they are changing the way that we do healthcare, head on over to my YouTube channel. That is youtube.com/WTF Health. I'm Jessica DeMassa. Thanks so much for joining us. Take care.